Welcome back. You're still watching The Globe. The Deputy Minister of Health, Dr. Sbongiseni Dhlomo, has launched the National Youth HIV Prevention Strategy and Campaign at Malamulele in Limpopo. The Health Department says that it will intensify the program for 3 years until 2025. The program, under the leadership of the South African National AIDS Council, is targeted towards preventing HIV infections amongst young people. Dr. Dlomo says that is encouraging adolescent men to practice safe sex. The Deputy Health Minister, together with other leaders, conveyed a similar message that cases of new HIV infections amongst the youth, in particular adolescent men, need to be reduced. Well, for more on this, we are now joined by the Deputy Health Minister, Dr. Sbongiseni Dhlomo. Thank you so much indeed for joining us. Welcome to the program. It's been a long time that we've known that young people are particularly vulnerable to HIV. Take us through the journey of what we know and what we're trying to do.
Thank you very much, Peter, and good evening to your viewers. In 2016, when we were actually collating the data, we noticed that we were doing relatively well as a country. However, we were actually sure that if you don't put up campaigns for especially the adolescent youth, you will not see them enjoying what we call a long and a healthy life up to about age 70. So the current president, President Ramaphosa, at that time as a deputy president, launched a She Conquers campaign in Pietermaritzburg 2016 that had 5 pillars amongst itself, looking into, can we as South Africa assist the young ones to complete matric without actually falling pregnant? Can we actually prevent HIV infections, sexually transmitted infections, reduce or remove gender-based violence, and empower them economically? That campaign started in 2016 up to 2019. We have now looked into the results thereof, and there are certain gaps, though it assisted us, but it was primarily focusing on adolescent girls and young women. It did not really emphasize a lot about programs that we need to put in place for adolescent boys and young men. So this new strategy is all-inclusive, looking into that. Again, this one is also driven by young people themselves, this National HIV Youth Strategy, where they are saying, we want to do it ourselves. We want to say, I am ready. We want to say, we want to actually focus on how do we assist ourselves, but supported by elderly people. Zikhala kanjani is their slogan, to say, yes, ziyakhala, meaning we are ready, we are focusing on these processes, but then they answer back the question, zikhala kanjani without the use of a condom? Zikhala kanjani without bringing yourself for testing? Zikhala kanjani when you are abusing a partner on a gender? So that slogan and that way of pushing programs, it's something that we as health, we as SANAC are supporting young people on their drive to say, we want to live a long and a healthy life free of HIV. 2030 is around the corner, where we are saying, can we have a society that is HIV-free, sexually transmitted infections reduced, no gender-based violence against women, and also testing continuously for TB and other illnesses, so that we can see our young people going right up to age 70 and more.
One gets a sense sometimes that because HIV now can be quite well managed by the use of medicines, ARVs, etc., that there's not as much urgency as in the past. And I wonder if the message of prevention is getting through.
The young people themselves were talking to us to say they encourage one another to say, I don't trust you, I don't trust myself, I can't go into a sexual activity without a condom until I know who you are. and until we know each other. So that message of prevention is still a message that they preach, that we support them on, because yes, we do have treatment here, but again, recording 1,300 new HIV infections as a country is something that per week is something that we really want to improve on. Because yes, you do get better, or you could prolong your life with ARVs, but you can still prevent, because we do have condoms available. We do have other programs that are supporting male medical circumcision. Those are the messages that are actually were being done or being promoted by the young people themselves. And we are here as government, as SANAC, we are ready to support them in these campaigns. So yes, the message of HIV prevention is still one that we really want to push and say, can we reduce numbers? Can we want to say, for us to have an HIV-free society is because we don't have more infections on HIV.
One hears stories of young people coming to clinics and finding it difficult to access things like condoms because staff are looking at them and saying that, you shouldn't be doing this kind of thing. I wonder if that part of the prevention strategy is also an aspect that's being taken into play to make it easier for young people to go and get help.
We are in the country have 1,700 clinics or health facilities that we now say have got what we call youth zones. What is a youth zone facility, health facility? It's a facility where there's at least one nurse who is actually having adolescent youth user-friendly services, because we are saying to our healthcare workers, yes, we probably should remove this attitude amongst ourselves. This 17-year-old is responsible enough to come to our facility and say, I am now sexually active. I want to finish my matric before I fall pregnant. Please help me. Now, it should not be us saying, go and call your pastor or go and call your mom or aunt. I need to discuss that with her. Because next time she will come, or maybe not even come to our facility next year, she will then be pregnant. So we need not to be judgmental, assist them with whatever they need. So this is a message, Peter, that we are spreading to our health facilities to say, please be youth user-friendly and provide them with sexual and reproductive rights and services, because we want to actually combat and decrease these sexually transmitted infections, HIV infections, and even teenage pregnancy. A 9-year-old falling pregnant now is not even a teenager. So we also want to really deal with these challenges in the country.
There's a message, I guess, for young people, particularly having sex with young people, but we also know that there's this phenomena of intergenerational sex, sometimes economic more than anything else. How are we helping our young people deal with negotiating safety in those kinds of environments?
Yeah, we still always condemn this behavior of immorality amongst men, older men. And we have always had slogans that are very touchy to say, imagine if this was your daughter, Peter, and therefore, if that message comes through to you, you do have young girls, your daughters. Imagine if this Dlomo is actually going out and chasing your daughter, then you just stop at that level and say, because I don't want it done to my daughters, maybe I should not do it myself. We should not be exploiting the economic challenges that our society has, poverty and child-headed household, and want to assist them to get better, but at the end of that day, they actually have to give in to the sexual desires and pressures of men. So that is a message that we are actually saying to these young girls, please, I know you are having a challenge of poverty but we need men who are morally upright, who are not going to be exploitative to our country, to our young girls, because in return, they are going to be assisting them to make life. So that is a message that should go to that is why we are saying nobody should be left behind, including adolescent boys, including young men, and because we need to stop that cycle of sugar daddies, intergenerational mixing, and people just undermining young girls and really using them as sex objects.
What are some of the myths that you think need busting, particularly for young people, that you're finding that you really need to address with this prevention program?
Look, I wish you were talking to young people. They would know that better than us. There are still those myths that are there that we come up with that says, look, if you are actually meeting a young girl who has never had sex, you are likely to then not to really have HIV with it. So all those myths that I don't even want to go into. Yeah. But what is actually key, Peter, is the message that must go to young people to say, we would want to prolong your life. What can we do to assist you? If it means you want to be closer to the sugar daddy and force that sugar daddy to use condoms because it is about your life. And that abuse of young women is something that we need actually to inculcate at a very young age to our both boys and girls, young men and young women. The integrity that must be instilled in them. But of course, we need to also be empowering them to finish matric and maybe look for opportunities and skills so that they could be on their own and maybe move away and not find men who are ever willing to exploit them economically for sex exchange of whatever they give them in making their lives going forward.
Has the COVID-19 pandemic complicated the messaging and reaching young people?
Mainly the COVID-19, let's agree that as healthcare workers, as leaders in health, we seem to have actually focused so much on COVID-19, which probably was the right thing, but therefore had less impact and focus on programs that we have always done, HIV, AIDS, TB focus, and therefore there is now a plan to accelerate those programs. But Peter, you probably know that because of COVID-19, children were at home, parents at work. We have picked up a lot of teenage pregnancies there. Among other things, why we went to Malamulele district today was again because that district in Limpopo province has got the highest number of teenage pregnancies around the COVID period. So yes, among other things that has happened during COVID is that we were a bit less focused on programs that were done so well on HIV testing and treatment and TB HIV testing and treatment, and therefore also having the exposure of our youngsters to be at home alone and therefore got into this unprotected sex and teenage pregnancy mushrooming. So yes, that has been an impact of COVID on our plans.
All right, perhaps as a final question, what will success look like for this program? What are your targets?
Peter, we do have a baseline now. We do have a baseline of how much we have teenage pregnancies in the country. We do have a baseline of 1,300 new HIV infections, especially amongst young people per week. We also do have the statistics of gender-based violence that we see. We are wanting to measure ourselves going forward in the next 3 years, because as we launched it today, as we launched the current gender-based violence, including teenage pregnancy, how much we impact on that, how much we improve the number of young boys who are actually circumcised, because we know that has a potential to decrease the transmission of the virus from one person to the other. So those are our key indicators that we are going to be looking at going forward.
And we certainly wish you the best of luck with that, and we'll help you as much as we can as the public broadcaster. Thank you so much indeed, Deputy Minister, for joining us.
Thank you very much, Peter, and thanks to your viewers.
Thank you.